Oh, right. Well, today again, acupuncture. And again, I didn't think Aaron got the point of this talk, but no pun
No
intended.
pun intended.
Um, but yeah, she's all interested in this one. A tool for pain management and opioid use reduction. I've been looking forward to this for a while. I was telling people before everybody got on that, we had a yoga talk, and then I did yoga for 6 weeks. We had to talk about nutrition, and then I watched all these shows and quit eating bad food. And so I'm really afraid that once this is done, I'm going to have needles all over my face for the next year. So we'll see how it goes.
I think the
Next,
question is, how long were you planning that joke for?
just came to me. Just came to me.
That's impressive. All right. All right, go for it, Kurt.
Okay, so upcoming, lots of great things coming up. We got Alexis coming up on neurology of OUD, which is really a lot of fun. We got the Pink Cloud Foundation. You want to tell us about that, Aaron?
Yeah, absolutely. So Travis is the fella that heads the Pink Cloud Foundation, and this is a foundation that provides down payments for sober housing or folks needing a safe place to go once they get out of treatment. And I feel like in a lot of areas of healthcare, we're just kind of siloed. Like, I had no idea that was even a thing. I did not know you needed a deposit. So it's just all about like, how can we help folks switch up their environment to ensure their success? My mind was just blown listening to him talk and some of the data that he put forward. So I'm pretty excited to see what he has to say.
Yeah,
And then
and then
we
we
have
have
some stuff coming up on human trafficking too, I think, which is always good. Kate LePage is a great speaker. She's been on in the past. And then Charlie.
yeah, Charlie's giving this talk prior to giving it at the American College of Physicians. He's a big speaker there every year on addiction, so he's trying it out on us. So we'll see how that's going to be a good talk. So next slide.
Like Kurt said before, we'd love it if you keep your cameras turned on. We are always curious about what everyone's eating for lunch, especially Kurt, now that he pretty much transitioned over to being vegan. So spread that motivation around for the healthy eating habits. But yeah, it's nice to see everybody. We do offer free CME for these sessions as well.
Yeah, and to be clear, Diet Mountain Dew has no meat in it, just so that we're clear.
Only bromine.
Yeah, like bromine. Remember, if you need any help, you can sure call us. These are some of the most interesting cases I ever hear about. So please feel free to give us a ring. Aaron's phone's there, mine's there. Get calls every week. So please feel free to get a hold of us if we can help you.
And then Stratus Health is the home to the core website. So if you need any policy, protocol, resources, anything like that, check it out. It's a really nice resource to have, so you don't have to reinvent the wheel.
And with no further ado, we will turn this over to Jessica Brown, and we will have her teach us how we can do this whole acupuncture in your own home. No, that's not actually true, but she's going to give us a little talk about what she does, and I'm dying to hear it. So go ahead, Jessica, if you want to share your slides.
Okay. Can you guys see that?
Yes.
All right. So, as Kurt said, my name is Jessica Brown, and I've been a licensed acupuncturist for 15 years and the lead APP for the Integrative Health Division at Hennepin Healthcare Systems in Minneapolis, where I've worked for the past 11 years. I'm one of 9 licensed acupuncturists on staff here, and today I'm just looking forward to discussing how this modality might be another resource in your toolbox. Our goal as acupuncturists is to work with other providers toward minimally invasive pain management and stress reduction as a complement to the care prescribed and administered by you and other providers. Let's see if I can, okay. So there are other provider types that do practice acupuncture in various forms and dry needling, but I will just speak to the education and qualifications of licensed acupuncturists in the state of Minnesota. LACs have graduate or doctoral degrees in the specialty field of acupuncture and traditional Asian medicine. Programs are 3 to 4 years of postgraduate training in biomedicine and traditional medicine with 700 hours plus of supervised clinic experience before we're unleashed on the world. We then undergo national board exams and become certified by the National Certification Commission for Acupuncture and Oriental Medicine. And in Minnesota, we're licensed by the Minnesota Medical Board of Practice. So we maintain our licenses through required continuing medical education, where a lot of providers pursue specialty training in a number of areas. The objectives of today's presentation are for you to leave with an understanding of what a patient may experience during an acupuncture treatment, a brief overview of what happens physiologically with the insertion of needles, the knowledge that acupuncture is both safe and effective and is indeed an evidence-based practice. And then in closing, I'd like to help you understand coverage for your patients and give you a resource in finding practitioners in your area. So it's important for a potential referring provider to get a sense for what your patients will experience during treatment. If you haven't experienced it yourself, you're the first opportunity to set a positive expectation for those patients, which is important when asking them to try something new, particularly when you're asking them to have needles stuck in them. The biggest barrier is trying acupuncture is often the fear of needles. And as partners in care, we hope you can assuage them of those fears and help them understand what they might expect before they come into a visit. The needles are sterile, single use, and extremely thin. They're generally just a tiny bit thicker than a human hair. There are varying gauges and lengths, but usually a ½ inch to an inch. Although we do have longer ones if we need them. Insertion of the needles can vary in sensation. Some points people don't feel at all, while others might feel like a little pinch or poke, almost as if a single hair is being pulled on your arm. Once the needles are administered, often they're no longer felt. And then we leave people to rest. Each treatment is individualized, and acupuncturists determine the amount and placement of needles based on patient comfort and the condition being treated. Typically, once that first needle is experienced and patients realize it isn't like getting a shot or getting blood drawn, they start to relax. They know that it's not going to feel painful. And the treatments themselves are usually 45 to 60 minutes in length. That includes intakes and assessments, the treatment, and then a 20 to 30 minute needle retention period. The retention period allows for a secondary relaxation response that's common in acupuncture. And in our health system, we schedule patients every ½ hour, rotating between 2 rooms. So while needles are retained in one patient, we're in with another patient doing intake and administering treatment. The treatment is meant to be comfortable, so that's something that we stress to the patient. They're in charge and can let us know if there's anything that they're not comfortable with. And after the insertion, the patient would be left to rest with the needles. The retention period allows for the rest and relaxation. And in fact, they've seen with functional MRI that the area of your brain involved with rest and relaxation is activated with the use of acupuncture needles, which Candy was alluding to kind of earlier, this kind of sedating effect that she has when she gets acupuncture. It initiates that sedating response without the use of any medication on the needle. And most often, patients leave the treatment feeling more relaxed and centered. There can be a cumulative effect to acupuncture over time, and so we do advise a series of treatments, anywhere from 4 to 6 to start, ideally 1 to 2 times per week. with reevaluation after to determine follow-up frequency and spacing of visits. Depending on the condition, we're hoping to see improvement, indicating follow-up treatment would be beneficial. As with many therapies and modalities, one of the barriers to positive outcomes is patient compliance and ability to attend a series of appointments. Acupuncture can provide an analgesic effect post-treatment, but for the longer lasting reparative effects to occur, there often needs to be a commitment to a full treatment course. And so that's another thing that referring providers can help with, is just letting patients know that they want them to try and commit to a treatment course. The course varies depending on the condition, the severity, and acute versus chronic nature. Those first 4 to 6 treatments give us a good baseline of how the body will respond, and then we'll determine the length and frequency of additional appointments after that. Our goal is always to get patients to a more manageable baseline after a series of treatments, and then discontinue or take a therapeutic break from care. We don't want people to feel like they have to be permanent patients. We want them to be overall in a better place, and then they know where we are when they need to come back. So I wanted to take a little time to show you pictures of acupuncture treatments in case you've never seen what it looks like. These photos are courtesy of my colleague, Uli Bayendorf, who's been practicing for over 30 years and has a passion for exploring the effects of acupuncture and documenting its results. The slides are demonstrating very localized treatments. This first one is post-discectomy on the cervical spine, and then the other is a scar treatment on a 55-year-old woman with post-hip replacement. And over time, a remodeling of soft tissue can be observed in patients, particularly with scar tissue, resulting in lower elevation in the tissue and less difference from one side to the other. Often this kind of treatment would be combined with non-local points to further enhance system-wide results. Sometimes we'll boost the needle's effects with the use of electroacupuncture. These units deliver a mild electrical current similar to that of a TENS unit, if you're familiar with that, but sent directly through the needles into the deeper tissue. The first picture is e-stim on the cervical points, and the second is an example of a treatment for trigeminal and facial nerve damage. This patient sustained a traumatic stab injury 15 years prior to the start of acupuncture treatment. Adding e-stim enhanced the results with a marked improvement in sensory response, and the patient reported that numbness went away entirely, which is remarkable 15 years post-injury. The stimulation is comfortable. We only turn it up to the point of mild sensation, and the use of electrostim can prompt the knitting of new neural connections and can be successfully applied to neuropathies as well. One of the things that we discuss with patients is the effects of balancing and changing the body and its tissues over time. So pain from soft tissue and muscles behaving uncoordinatedly can benefit from acupuncture. Here you see the appearance of needles at the end of the first acupuncture treatment. So these needles would have been inserted at a really uniform angle at the start of treatment. And as the muscles and tissues respond to the needle stimuli, they can shift and fire, and you end up with kind of this haphazard look to the needles. This would be an uneven response pattern of lengthening and shortening of the muscles, and just shows you the level of tension and what happens when you have tension in those muscles. Shifting to the next picture, this is at the end of the treatment number 11. So the acupuncture has encouraged an improvement in fiber realignment, and at the end of the treatment course, you can see that the muscles and tissues have reached a less reactive equilibrium. They're no longer responding so dramatically, effectively creating a new normal of a more relaxed and healthy state. And we talk about that a lot for multiple conditions, ostensibly creating a new normal that's more tolerable to the patient versus the kind of distressed default that our bodies sometimes adopt with chronic pain. And then this is just an example of thermographic scans of an osteoarthritic knee. This is a hot knee, not in a good way. The first picture is prior to treatment, so you can kind of see the redness. The second is 10 minutes post needle insertion, and you can see the handles of the needles in the imaging indicated by the dark blue lines. And the third is 20 minutes after acupuncture treatment. So 20 minutes after the acupuncture needles have been removed. You can see through the progression of the slides, the overall reduction of inflammation with the introduction and retention of acupuncture needles. So before I move into the kind of hopefully not boring, but definitely information dense aspect of the presentation, I want to point out that research is always ongoing. There are innumerable opportunities for developing a greater understanding. However, there are a great deal of quality studies available on acupuncture, and I want to point out quickly a few helpful resources where some of the information has been synthesized from for this talk today. In 2017, a white paper was amassed titled, and this is a mouthful, but I'll get through it, Acupuncture's Role in Solving the Opioid Epidemic, Evidence, Cost Effectiveness, and Care Availability for Acupuncture as a Primary Non-Pharmacological Method for Pain Relief and Management. And this was presented in a congressional briefing on Capitol Hill in 2017, sponsored by Congressman Tim Ryan, the Democratic co-chair of the Congressional Addiction Treatment and Recovery Caucus at the time, and Congresswoman Judy Chu, who had introduced federal legislation to make acupuncture available to veterans. Another resource, that second link, is the Society for Acupuncture Research, which was established in 1993 with the objectives of advancing research methods for acupuncture and allied therapies. And their aim is to identify mechanisms of clinical effects from acupuncture, inform knowledge gaps and future research directions, and disseminate and implement the research findings. This site contains evidence-based assessments and white papers, some of which are accessible to members only. So if anyone wants to reach out to me for available materials, please feel comfortable to do so. They have some really interesting one-pagers on analysis of various conditions and the research available. And then lastly, the evidence-based acupuncture is another site with helpful overviews of the scientific research available. So this, try not to go blind looking at this, but this is admittedly a very busy slide. I don't mean for you to have to read the whole thing. I'm not going to spend a lot of time here, but I wanted to share some of the known and studied mechanisms of action that occur with the insertion of needles at prescribed points. This slide could benefit from an entire talk itself, but due to time, I'll simply summarize that there's been much research on how it works. Acupuncture has demonstrated analgesic and anti-inflammatory effects. Influenced by acupuncture on numerous biochemicals have been identified, including opioid and non-opioid neuropeptides and neurotransmitters. And studies demonstrated direct effects on the central nervous system, including spinal reflex effects, change in functional connectivity in the brain, regulation of hormones, and the physiological stress response, as well as modulation of parasympathetic activity. Acupuncture at its core is a stimulation therapy that acts on the neuroendocrine system involving both central and peripheral nervous systems. And there's ongoing research into how it works. But the fact is there's most certainly multiple mechanisms of action. We know that it causes a release of your body's own naturally occurring painkillers, including endorphins and enkephalins. It promotes circulation and has an impact on the brain's ability to downregulate. So it taps into the area of your brain involved with that rest and relaxation, as I mentioned before. One way I like to explain it simply is that the needle creates a micro trauma, triggering the body's own healing response, similar to that of a real injury without any lasting damage. So it's important to start with the assurance both to you and to your patients that acupuncture is a safe practice. In the hands of trained practitioners, there's minimal side effects or risks associated with it, sometimes bruising or discomfort at a needle site. In very rare cases of vasovagal syncope related to fear of needles, which is generally pretty easily resolved within the treatment room prior to the patient leaving. In fact, in an analysis of multiple studies out of almost 4.5 million acupuncture treatments, the number of reported serious adverse events was only 11. And then continuing in that topic, there was a trial involving almost 425,000 patients treated for pain complaints, including headache, low back pain, and osteoarthritis, in which minor adverse events were reported in 7.9% of patients. Again, we're talking probably maybe a bruise or a little discomfort at the needle site, while 0.003% or 13 patients out of 425,000 experienced a serious adverse event. So minor adverse events like needle site pain or hematoma, and then serious events included pneumothorax, hyper or hypotensive crisis, and aggravation of asthma or suicidal thoughts. Those serious events are important to be aware of and sound understandably alarming, but when put up against treatment options, including pharmacological, acupuncture actually proves to be one of the safer options for care, if you look at those statistics. And just personally, with the over 10,000 treatments administered each year by providers just in our system, stretching back over 30 plus years at HHS, we've yet to encounter an incident to that level of severity. So the takeaway is that acupuncture is a safe modality with several studies confirming the safety when performed in the hands of a trained and competent provider, which in Minnesota, if you're going to look for a licensed acupuncturist, you can be certain that we've all had kind of the same commensurate level of training and certification. It's been categorized as safe and effective and can be recommended as an adjunct to conventional therapy. And though few complications are reported, even the more common side effects, such as soreness at the needle site or instances of bruising, are not as common as you might think due to the thinness of the needles. They're super thin. So we don't even get bruises very often. Okay. So certainly pain is the most studied realm for acupuncture, and it's been found to be effective for the treatment of various types of pain, with the strongest evidence for back, neck, and shoulder pain, as well as chronic headache and osteoarthritis. Referencing the study on safety that we looked at when the effectiveness for pain reduction was marked or moderate in 76% of cases. And it's been shown to be as good as other available options and is sometimes superior to standard pharmaceutical care. In this study on the treatment of sciatica, acupuncture outperformed ibuprofen, diclofenac, and prednisone. And in other meta-analysis, it was superior to other interventions, including non-opioid and opioid medication. Acupuncture often has demonstrable effects on mood for patients, and we see this all the time with reported reduction of stress and increased sense of well-being. And that's a very qualitative kind of assessment, right? So it's sometimes difficult to study, but more studies needed. And however, evidence is promising to suggest benefit in addition to medication for treatment of depression, and is also promising, though a bit more limited, for the treatment of anxiety disorders. A quote from an assessment of evidence for depression reads, "Regardless of treatment, Current guidelines stress the importance of building a strong therapeutic alliance between the provider and patient. Fortunately, this is often the case with acupuncture and was recently assessed in large trials comparing acupuncture, CBT, and usual care. Based on the findings, the authors recommended a combination of both acupuncture and psychotherapy. So one of the ways in which an acupuncturist can be a partner in the care of your patients is that we often are asking about the whole person, including asking not just about a primary pain complaint, but also sleep, mood, digestion, etc. So in this way, we're kind of an extension of your visit, attempting to get to the root in addition to treating the main complaint. We welcome the patient to share not just the quality and severity of their pain, but also to discuss the impact it may have on other aspects of their lives. So I found a lot of really interesting material on acupuncture and opioids. Some studies have shown that acupuncture can be helpful in decreasing the amount of opioids needed to treat pain. And this first one is talking about a study of emergency room patients with acute, moderate to severe pain, and acupuncture provided more effective and faster analgesia than morphine, and was better tolerated due to the low incidence of side effects. Other studies have reported reduced consumption of opioid-like medication by more than 60% following surgery. And in a study examining acupuncture effectiveness at a U.S. Air Force Medical Center, acupuncture dramatically reduced the use of opiates among personnel. Opioid prescriptions decreased by 45%, muscle relaxants by 34%, and benzodiazepines by 14%. There was also statistical significance in the improvement of quality of life measurements. And in a 2014 study, acupuncture demonstrated a decrease in the amount of morphine used by addicts in treatment and improved sleep. A meta-analysis agreed on the efficacy of acupuncture as a strategy for the treatment of opioid addiction and determined that it can reduce the effects involved in opiate addiction by modulating mesolimbic dopamine neurons. Harkening back to the slide, that dense slide on mechanisms of action, several brain neurotransmitter systems involving opioids and GABA have been implicated in the modulation of dopamine release by acupuncture. In a 2017 analysis, the entire literature base of over 13,000 studies up to that time and hundreds of meta-analyses were summarized, pulling a great deal from prior reviews by both the Australian and US Departments of Veterans Affairs. They found evidence of effect at that time for 117 conditions, including strong to moderate evidence for 46 conditions. So a lot of times acupuncture is helpful in treating the underlying conditions that may have been the start of potential substance use disorder. And on the list of strong evidence for positive effect, conditions like back pain and postoperative pain, headache and knee pain, as well as nausea and vomiting are included. And then there's moderate evidence of positive effect for neck pain, post-stroke conditions, cancer-related symptoms, PTSD, anxiety, pelvic pain, insomnia, extremity pain, digestive pain, and more. I'm not going to read all of them, but it's a fair amount there. So regarding accessibility and coverage, acupuncture coverage is plan dependent, though many of the major commercial payers offer reimbursement, as do most medical assistance plans, which is great. And that's certainly a large part of our patient base here at Hennepin. We love those patients, and we love that we get to be a place for them to receive care. The conditions covered and approved for acupuncture are primarily musculoskeletal pain conditions, as well as headaches, chemo-induced or pregnancy-related nausea and vomiting, and women's health issues, including amenorrhea, dysmenorrhea. There's expansion with some plans to cover some mental health conditions, including anxiety and depression as well. And though the conditions can be limiting, we can actually work pretty successfully within these parameters for many conditions. So for instance, maybe the patient arrives with perimenopausal symptoms such as hot flashes, night sweats, emotional distress, or sleep difficulties. There's often a pain component in there that also needs to be addressed. And so potentially joint pain or headaches, which is likely covered. We can also treat that in the visit in addition to the other concerns that the patient has. Acupuncture was added as a covered treatment for a very specific kind of low back pain by Medicare. I think it's been 3 years now. This was seen initially as a win for patients. However, LACs, licensed acupuncturists, are not currently listed as CMS providers. And therefore, as it is currently written, we need to be supervised by an MD, a PA, or an NP. This is prohibitive, as even in a large medical system like ours, we're still independent providers. We don't have MDs in our space, in our clinic. And so as the experts in this needling modality, we're not supervised by other provider types when we're administering care. So until acupuncturists are listed as CMS providers, there are few systems, let alone community providers, who can be compensated for treatments by straight Medicare. There are often supplemental plans that will cover, but the results sometimes are in an out-of-pocket cost falling on the patient, which obviously is not ideal. So our profession, and most importantly, the patients, really need the voices of providers like yourselves to advocate for expansion of covered conditions, and also the CMS edition of LACs as providers in order to access this proven modality. So we need your help. In terms of where to find an acupuncture provider, so in attempting to find providers in your area, there are a few tools, but one great one that I want to highlight is nopainminnesota.org. In a joint effort between some of my colleagues at Hennepin Healthcare and the Minnesota Department of Health, No Pain Minnesota was launched as a tool to help patients find non-opioid pain alleviating therapy options. There's been a pause in updates for about 6 months, but now work will resume in April and thankfully be funded for the next 4 years. If you visit the site, you can click on search the resource map and query by location or treatment method, or both. And you'll find options not just for acupuncture, but also chiropractic, massage therapy, psychology, rehabilitative therapies such as PT and OT, movement and mind-body therapy options, and functional or integrative medicine MDs. It's a powerful tool for patients and providers to find options for care, and it'll only continue to improve as the work progresses. I know I said a lot very quickly, but I wanted to share some takeaways for you and your patients. Acupuncture has shown moderate to strong evidence of effectiveness for a multitude of conditions. It's considered safe in the hands of properly trained practitioners. It's often a covered service by many payers, and patients, medical professionals, and healthcare administrators can be confident that the recommendation of acupuncture for many patients is a safe, cost-effective, and evidence-based recommendation for care. And then I'm going to just leave you with a couple of QR codes, information about another Echo series, this one hosted by Hennepin Healthcare. These links will take you to information for upcoming series beginning in April, one for integrative pain care and the other for trauma-informed care. Thank you for your time, and I'll open it up to questions.
Do you want to close your slides so everybody's on the same?
Yes, stop share. There we
There
go.
you go. Now I have questions, but we'll see if other people have questions first. I know Erin has questions. She has that look on her face. Anybody
Let's
throw
let's
something
have
out
She
there?
has the look on her face. Sorry.
Oh, that's okay. Abby posted one in the chat that says acupuncture has been life-changing for me, managing chronic stress, upper back, neck muscle tension. I'm a walking billboard. What is the typical treatment course expected for arthritis? Thanks so much for this talk.
Ooh. So that's a good one. Our arthritis is one of those things. Obviously, it's a progressive condition. So we're not going to cure anyone of arthritis. So it's mostly about management. And what I tell people is if they're in an acute flare of pain, usually we're going to want to do that treatment course where we're going to get 4 to 6 treatments relatively close together, 1 to 2 times per week. And then what we try and do is we actually try and space out visits because it's a stimulation therapy. Your body kind of gets wise to it after a while. And so you do want sometimes to take a little bit of a therapeutic break and start to stretch out the time in between. And then if you have another flare, if you're going on vacation and you want to be really active, you might front load a little bit, or on the tail end, try and get more visits in order to manage the pain that comes with that. But obviously there's different kinds of arthritis too. I'm kind of speaking more to osteoarthritis. When we're talking about a degenerative arthritis like rheumatoid arthritis, we're looking at creating kind of longer plateaus so that the pain isn't ramping up this way, but that we're actually kind of slowing down the progression of pain and making it more comfortable for people. So again, I that was a long way of saying, I like to start off with a series that's relatively close together, and then kind of try and space them out and see how much relief we can get for a period of time. Does that answer your question?
Yeah, thank you so much.
Yeah.
Other questions from the audience? Otherwise, jump in, Erin.
So my question is, we all know in working with folks who struggle with addiction, and with opioid addiction in particular, it can be really scary to go to a new provider again and disclose exactly what's going on because there's so much stigma. This is viewed as a moral failing in society. So if or if a patient with opioid use disorder has been referred to you, is there kind of a certain place that you start the conversation or start the treatment session? Or is it just like you go off of records more so to kind of get a feel for like mental trauma that's occurred? Or like, how do you go about those visits in particular?
That's a really good question. And what I'll say is, being part of Hennepin, I feel really lucky that we do have a lot of that information available versus like a community practitioner may not have all of that information. And we always do chart reviews before a new patient comes in. That being said, I want to meet the patient where they are when they come in the room with me, without too much expectation. And I want them to be part of the guiding process of goals and outcomes. So a lot of it is just asking where they are today, asking what kinds of elements would they see later that would make them feel successful. We talk a lot about the subtle effects of acupuncture. Sure, sometimes we have people come in with a pain level at an 8 and they leave and it's at a 3, and that's really easy to identify. But I think the power in acupuncture is often in those subtle results, which is, oh, I noticed that I didn't need to use as much medication. I noticed that I just felt a little better. Or it's like noticing that you didn't notice, right? Like being able to go a couple days and realize, oh my gosh, my pain wasn't first and foremost in my head, or I didn't feel as strong of a desire to use, or, and so sometimes it's those subtle things that we coach patients to try to acknowledge and notice. Because I do think the subtlety is actually very helpful. We're not trying to make drastic, major changes with people when they're already like really kind of have a lot going on or struggling. We want to help be a part of just gently nudging them along. And so, yes, we do utilize the benefit of having information available. But I also just feel like it's important to just meet somebody. We don't have rooming personnel. Like, there's no medical assistant that rooms our patients. We don't have anybody that cleans our rooms. Like, we are the person they see after they're checked in. We're the person they see from the waiting room all the way back to the room. And sometimes even those conversations are really powerful, right? Like, just getting a gauge for how people are feeling. How you walk in on them in the waiting room tells you a lot, what they look like, how they're sitting, and then how they're walking back to the waiting area can give you a lot of information, not just about how they're doing physically, but also where they're at kind of emotionally. Are they down? And so we're touching them at we're seeing them at the very beginning of the visit all the way through to the end of the visit. And I do think that there's benefit to that.
I have a question about like very specific pain. And the thing I always think about it, we send patients and they're like getting, for instance, trigger point injections into certain spots.
Sure.
Do you do anything like that as far as on trigger points where you'll put the needle right into that same area?
Yeah. Patients often ask, like, are you going to put it in a nerve? And no, we're not going to put it in a nerve because that would really hurt. But what we do is often the benefit of a setup like we have, because there are different types of acupuncture. There's community style acupuncture, which is also amazing. It's usually a sliding scale fee. It's a group setting. They use largely distal points on extremities and maybe head and ears. That's a wonderful way of getting treatment. Here we have the benefit of doing very local treatments, as well as adding points for more systemic concerns as well. So oftentimes if somebody's coming in for a low back pain, unless there's open wound or an issue with how they're going to lay on the table, we're going to go at that low back. Like, we want to get into that area that is causing difficulty. And like I said, our tools vary in terms of gauge and length. And so if we have a larger body type, we have some longer needles so that we can get into the layer of muscle that we really want to get into. So we're not doing injections, obviously. There's nothing on the needles, but we are definitely trying to stimulate the healing response in very specific areas, as well as system-wide.
Okay.
I have another question.
Mhm.
What are some of your favorite tricks, like from a general standpoint? Do you have some buddies that you like to put with acupuncture, like essential oils or mindfulness, or I know you noted psychotherapy? Like, what are your favorite generalized things that you're like, patient, you should really do this, you'll feel good?
Yeah. So we have 9 providers in our system, and then there's hundreds across the state, and you would probably get maybe a slightly different answer from every single one, which I think is wonderful, actually, because, for us, we refer back and forth to each other all the time. Like, maybe you should go see so-and-so and get a second set of eyes on it. For me personally, honestly, it's the relationship and the connection. I spend quite a bit of time talking to people when they come in. I think that that's a really, when you're asking someone to trust you to put needles in their body, I think that relationship is so important. So I do spend a fair amount of time talking to people before they're on the table and then while they're on the table. And I get to know people's lives. I get to know their partners' names. I get to know their kids' names. I get to know their pets' names. because I think, that's knowing people's life experience and what they're going through is part of the whole picture. And certainly that's kind of the lovely part of acupuncture is we are trying to work on the whole picture, not just the main pain complaint. But I do like essential oils. I do use some essential oils. I do tend to, I'm a provider who likes to also lay hands on after the treatment. So I do a tiny bit of massage, either on the face or the affected area. We have some providers that use cupping. I use cupping sparingly, partially, honestly, because it's not covered. And so when we're seeing like 14 people a day, it's hard to kind of turn around all the cups with the sterilization and everything. But we do have some providers who will also do cupping when it's appropriate. And then we also have some providers who still, even though we don't supply them in the system, they do make herbal or formula recommendations for patients too. Again, I don't do a lot of that because a lot of the med lists for our patients are so extensive. You have to be really careful with contraindications. And then compliance is difficult and cost. All of that would be out-of-pocket cost. And so that's just it's going to be a very particular kind of patient who can afford that. So
I think I'm a little biased, Aaron, but I think if you were doing that in my maple syrup shack and the smell of maple syrup was in there with the acupuncture, the cure rates would be off the chart. But
if you send me some, Kurt, then I will use it as part of my treatment as an essential oil.
Yes. Do you get people that are just clearly a non-responder? They're just like, it just doesn't do it. You just can't get everything you try.
Yeah, we do. I think anybody gets that. And it's difficult, but we don't get a lot. I mean, I would say more often we get people who are surprised that come in and they're skeptical and then they leave and they're like, wow, I feel really great. And they're like a little uncertain about that because they came in with pretty low expectations. But sure, I think the difficulty, again, going back to what I talked about with compliance for an ability to maintain a treatment course, that part's hard for people.
Yep.
So oftentimes what will happen is not an outright kind of rejection of any benefit to it or anything, but it's like they come in once and then they're not, due to transportation or maybe housing instability, or they're not able to come in, and then they come in, 6 months later and they say, well, I came the one time and I felt good for 2 days, but then my pain came right back. And so some of it is, if you are able to get them back, is having that conversation about, what a treatment course looks like and the benefit to having kind of continuing care. But certainly, I mean, we get some who are, I think that's difficult. I think it's difficult for those patients. And I always have a lot of empathy when they, nothing works for me. This doesn't work for me. Nothing works for me. And so sometimes you can gently kind of coach and talk about, well, okay, what does works for me mean? Like, are you finding that your activities of daily living are a little bit easier? Are you finding that you're walking a few more steps? Are you, and so really you're looking for some of those kind of setting smaller goals and looking for smaller measures of improvement. But yeah, I mean, I think we all get patients once in a while who don't respond as you wish they would.
Anybody else with questions? I know Aaron probably has one more and I have one more. Anybody else wants to unmute? And all right. You got something, Aaron?
Go for it.
Okay, so this is my last question. When we look at behavioral kind of things, is there anything that's been shown in studies to be helped with acupuncture? And I'm thinking of things like maybe agitation or anger management or things like that.
So using acupuncture to modify behavior.
Yes.
So I think I don't know if I can speak to any studies related to anger, but certainly there have been some studies related to the protocol for, it's called the NADA protocol. It's a protocol for addiction, particularly using the ear, and reduction of cravings for people. And to be honest, I think it's a little bit mixed. I personally, anecdotally, have had patients who've responded really well. We use it for things like smoking cessation, or even cravings for other substance use disorders. So as far as like anger, it's interesting. All I can speak to again is anecdotally without giving you, unfortunately, a lot of research behind it, which doesn't mean it doesn't exist, but, and I can certainly look into it, but you see a change in people when they're on the table. And if you can get needles in, and I spoke to this in the talk too, there often is a change in just their overall sense of well-being. And me as a practitioner, I try to make sure that people feel very safe in their treatment, because we know that anger, the root of anger, a lot of times is sometimes vulnerability. It's not feeling safe. It's a self-protective mechanism, and so it's really important in a treatment capacity that people feel safe. And if you can establish that, and then you can get them in a quiet room where all the stimulation is kind of turned way down. So we turn the lights down, we turn the music down, or we turn a little bit of music up, and we turn the lights down, and we make it a very kind of controlled and safe environment. Oftentimes I use warm blankets. Who doesn't love a warm blanket? But you see a change in people from when they come in and they might be agitated by, just life or something that happened on the way here. By the end of treatment, you can see a change in how they're going out. And oftentimes then when they come back, they'll express that I just had a better week. I was less reactive. And so as far as studies go, like I said, I don't have that information in front of me, but anecdotally, I can tell you from experience, I see it.
Okay. Good. Anything else? Well, gosh, Jessica, that was amazing. I think we all, have just so many questions about it. And I think the data has always been there. The data has been pretty clear that it is certainly helpful. So, I think we don't utilize it probably enough. And I think it's like, who do you use in your community? And I think we just have to look at that a little more carefully. Yeah.
And I do encourage you to check out that No Pain Minnesota site, and in terms of, because it's not just acupuncture, there are other modalities on there. But that is a big barrier for people often, is just finding a provider. And so that's a useful tool. But I really appreciate you letting me talk to you today.
Yeah, really a great talk.
Thank you so much.
Thank you.
If there's any like a one sentence thing that we could use to prime the pump before putting a referral in to an acupuncturist, what would it be?
To the patient?
Yeah.
To the patient.
Yep.
Oh gosh, that's a really good question. I mean, I think it depends on the patient, right? Some patients want to know, is it going to work? And then you can say, there's a lot of evidence that it's really helpful for this. And some patients, it's nice to just say, you know what, you're going to go and they're going to be gentle and they're going to take care of you. And it's going to be an hour where somebody is just focused on you. And also you're going to be able to rest. Yeah. Like, I think the power of being in a dark room and being able to rest away from your home, where you're not surrounded by all of the things you have to do. I mean, you can't do anything when you're here, right? Like if you have needles in, you may as well just relinquish, right? And there is an element of that I think is really powerful. People come in and they relax because there's nothing else they can do. It's not like they can get up and do laundry when they have needles in, so they may as well just relax into it. And there aren't very many spaces in our life where we give ourselves permission to do that. So I think that is also helpful.
That is helpful.
Yeah.
I think for me, Aaron, I'll say, Abby and Candy said this thing works like crazy. So I'm just sending you in. So
There you go. There's nothing better than testimonials, I tell you. Like,
Hey, anybody ever wants to know, does it work? Oh, absolutely. It's fantastic. Resets my.
Candy and I have talked about this a few times, and I just like haven't made it a priority to go. But after this talk, I'm sold. I'm like, I'll be emailing you after this. I want to try this. This sounds very cool. And
well,
Kurt's
that's the
probably
other
thinking
thing.
the same thing. He
Often
needs
we'll
yoga
just
now,
tell
so.
people, like, we can't guarantee results. Like, I don't know anything that can guarantee results, but what I tell people is the risk is so minimal, and so why not give it a try?
Yeah.
And honestly, as I told you, I tried it the first time for depression at that point, and it didn't do much, didn't do anything significant. I thought, that really didn't work. But I always give things 2 tries. And so I gave it a second try, and then it clicked after that. So, and then, like I said, I just use it to reset my Zen every 2 weeks. It's
I
awesome.
love it.
cool.
That's great.
All right, everybody. Thank you so much for coming. We will see everybody next week. And if anything comes up, please get hold of Katie or Aaron or myself. And again, Jessica, thank you so much for an interesting talk.
Thank you so much.